Most people over 60 are told the same thing about their bathroom. They are told that slower, weaker, and more often at night is just a normal part of getting older. It sounds sensible. It sounds harmless. But here is what nobody tells you. Some of the changes you have learned to live with are not aging at all. They are the earliest warning your body knows how to give. In urology and colorectal clinics, this pattern is seen every single week. A patient describes a change they first noticed months ago and only mentions it today. Most of those changes turn out to be minor, but a few are the first and sometimes the only warning of something serious. In the next few minutes, I will walk you through 5 bathroom changes that doctors quietly wish you would report sooner. And I will end with the one change most people wait the longest on because it does not hurt. The number 1 change on this list is something almost nobody talks about out loud. Stay with me all the way to the end because understanding that one signal could change how the next 10 years of your life unfold. Now let me tell you why your doctor may never have brought this up. A typical appointment lasts about 12 minutes. In that time, your doctor is checking your blood pressure, reviewing your medications, and reading your last set of numbers. There is almost no time left to ask gentle questions about your bladder or your bowels. And most of us do not volunteer it. We are a little embarrassed, or we have quietly decided it is simply age. So the change sits in the room, unspoken, sometimes for a year or more. I want to be honest with you about what this channel is. I am not here to sell you a supplement, and I am not here to scare you into a course. This channel exists to give you the science that a 12-minute appointment never has time to cover. That is the whole mission, nothing more. And the stakes here are not really about your bathroom. They are about your independence. A change caught early is often a small fix that keeps you living in your own home. A change caught late can mean surgery, hospital stays, and losing the freedom you have spent a lifetime building. So before we start, tell me in the comments, what is your age and which country are you watching from? I read them, and it tells me exactly who I am talking to. Here is the one idea that makes everything else make sense. Your urinary and digestive systems are the waste removal plumbing of your whole body. When something changes upstream in your kidneys, your bladder, your prostate, or your bowel, the very first place it shows up is often in what you see and feel in the bathroom. That is why these changes matter so much. They are early messages from organs you cannot see. Think of the warning light on the dashboard of your car. It is a small light, and you can drive past it for months. Nothing feels wrong. But that light is not the problem. It is the cheap, early warning that lets you fix a small thing before it becomes an expensive breakdown on the side of the road. Your bathroom is that dashboard, and every change we discuss today is a light on it. Please do not skip this next part. It is the key to everything that follows. And if this is already making sense to you, tap the like button now. It helps more seniors find this in time to get checked. Let us start the countdown at number 5. Number 5 is a change in the stream itself, a flow that has become weak, slow, or starts and stops. Here is what is happening underneath. The tube that carries urine out of your body sits near muscles and, in men, the prostate gland. As we age, that gland often enlarges and the bladder muscle can weaken. Picture a garden hose that someone is slowly stepping on, so the water is still there, but the path out is narrowing. The stream weakens, splits, or stops and starts, and you leave the bathroom feeling you are not quite finished. Large studies of men over 60 consistently show that an enlarged prostate is extremely common. In women, weakened pelvic floor muscles can create a very similar sense of incomplete emptying. Here is what to actually do. For the next 7 days, keep a simple log by the toilet and note one thing each time, whether you felt fully empty or not. If more than half of those trips end with that unfinished feeling, that is your signal to tell your doctor. Do not wait for it to become painful. Also count how many seconds you stand there waiting for the stream to start. And if it is regularly more than 10 seconds, write that down. These small numbers turn a vague complaint into something your doctor can act on. While you arrange that visit, there are safe things you can do at home. Sit fully upright, do not rush, and try leaning slightly forward to help the bladder finish. But here is the hard stop. If you ever reach a point where you cannot pass any urine at all and your lower belly feels full and painful, that is a same-day emergency, so call for help immediately. Pair this log with your medication list. Some common pills, including certain cold medicines, can quietly make emptying harder. When you bring both papers together, your doctor can often find a simple cause in minutes, but a weak stream is only half of the nighttime story. Because the real problem for many of you is not how you go, it is how often the bathroom pulls you out of bed in the dark, and that next change carries a danger the stream never does. Number 4 is waking 2 or more times every night to urinate. Not once in a while, but as your new normal. During the day, gravity keeps a lot of fluid pooled in your legs. When you lie down at night, that fluid returns to your bloodstream, reaches your kidneys, and becomes urine while you sleep. In some conditions, like a strained heart or high blood sugar, far more of that fluid shifts after dark. Think of a bucket with a slow daytime leak that suddenly empties all at once at night. That is your bladder at 2 in the morning. Geriatric medicine consistently links frequent nighttime urination to several conditions, from heart and kidney issues to diabetes and, again, the prostate. It is rarely just the water you drank. So here is your plan. Track your night trips for 3 nights in a row, and if you are waking 2 or more times and this is new, that crosses the line worth reporting. First, try one simple experiment. Stop drinking 3 hours before bed and lift your feet up level with your hips for 30 minutes in the early evening. Do that for 1 week. If you still wake 2 or more times, tell your doctor and bring those 3 numbers with you. Now the safety piece, because this is where independence is truly on the line. A dark room and a sleepy walk are how many serious falls happen. So tonight, put a nightlight on the path to the bathroom and clear every rug and cord from that route. And if you ever feel dizzy when you stand in the night, do not push through it, but sit back down, wait, and rise slowly. Pair your night log with the time you take any water pill, sometimes called a diuretic. If you take one, ask your doctor whether shifting it earlier in the day is right for you. Never change the timing yourself, but that one question can transform your nights. Still, waking at night is a change you can at least see and count. The next one is far sneakier. It can arrive with no burning and no obvious sign, and in older adults, it sometimes shows up as confusion or a fall instead. Number 3 is a sudden change in urgency or control, or an infection that hides. This is the leak that appears from nowhere, the dash you cannot quite make in time, or the strange off day that is really an infection. Here is the surprising part. In younger people, a urinary infection announces itself with burning. But in older adults, the alarm system is quieter, so instead of burning, an infection can show up as sudden confusion, new unsteadiness, or a fall. Think of a smoke alarm with a fading battery, where the fire is real, but the warning sound has gone soft. That is why a sudden change in an older person's mind or balance always deserves a look at the bladder. This pattern is well documented across geriatric medicine. Clinicians are taught that a sudden change in an older adult's thinking can be an infection until proven otherwise. So here is your rule. If you or someone you care for has sudden new urgency, leaking, or an off day of confusion, do not wait the usual 2 weeks. Call your doctor within 24 to 48 hours and ask specifically about a urine test, which is a simple 5-minute check. For ongoing urgency that is not an infection, start a bladder retraining habit. When the urge hits, pause, breathe slowly, and hold for a count of 5 before you move. Over several weeks, stretch that pause longer, and it genuinely helps. A safe first step at home is to keep the path clear and the clothing easy so an urgent trip never becomes a fall. But here is the stop sign. If there is fever, shaking chills, or pain in your back or side along with these changes, that can mean the infection has reached the kidneys, so seek care that same day. Do not wait for a scheduled visit when those signs appear together. Pair any confusion episode with a quick note of the date and what happened, and bring that note to the visit. Doctors often miss the pattern because each episode looks small alone, but written together, they tell a clear story. So keep it simple, just a date and one honest line. Now, everything so far has lived in the urinary system, but your body has a second drainage line and it carries its own warnings. The next change moves to your bowel, and it is one of the most important signals on this entire list. Number 2 is a lasting change in your bowel habits or in the look of your stool. New constipation or diarrhea that will not settle, stools that have turned pencil thin, or stools that look black and tarry. Your bowel is a long, smooth pipe that has kept the same rhythm for most of your life. When that rhythm changes and stays changed, something is altering the pipe. A narrowing can change the shape of what passes through, which is why a new, thin, ribbon-like stool matters. And black, tarry stool is different again because it can be the sign of bleeding higher up, digested along the way. Think of rust-colored water from a tap where the color itself is the message. Major cancer and gastroenterology organizations are consistent on this point. A persistent change in bowel habits and any bleeding are among the warning signs that should always be checked. Here is the line to remember. If a clear change in your bowels lasts more than 2 to 3 weeks, that is your cue to report it, not to wait it out. If you ever see black tarry stool or bright red blood, call your doctor within a couple of days, even if it happens only once. While you wait, you can help ordinary constipation safely. Aim for 25 to 30 grams of fiber a day and drink 6 to 8 glasses of water to move it along. But food changes do not cancel the visit, they only support it. Add that fiber slowly over 1 to 2 weeks so you do not trade constipation for cramping. And here's the emergency stop. If you have heavy, ongoing bleeding or black stool along with dizziness, weakness, or a racing heart, that can mean serious blood loss, so do not drive yourself and call for emergency help right away. Getting there safely matters as much as getting there fast. Pair your fiber with movement. A 10 to 15-minute walk after your largest meal helps the bowel keep its rhythm, and the two together do far more than either alone. Keep the pace gentle and let it become a daily habit. But there is one change I have deliberately saved for last. It is the one people wait the longest to report, for a reason that sounds almost backward. They wait precisely because it does not hurt. Here is the number 1 change on this list. Number 1 is blood you can see in your urine that comes with no pain at all. Your urine looks pink, rusty, tea-colored, or clearly red, and nothing hurts. Now, why is painless the dangerous word here? Because pain is what drives us to the phone. A kidney stone hurts, so people call the same day. But when blood appears without pain, the mind does the most human thing, and it waits. And then, often, the color clears on its own after a day or two, and the relief makes us decide it was nothing. Here is the hard truth. Painless, visible blood in the urine is one of the most important early warnings in all of medicine. It can come from something simple, like an infection or a stone, but it can also be the first and sometimes the only sign of a growth in the bladder or the kidney. Think of a single knock inside the wall of your house, which might be the pipes settling or might be the first sign of a leak that will flood the floor. You cannot tell from the knock alone, and that is exactly why you do not ignore it. Urology guidelines across the United States, the United Kingdom, and beyond are strikingly consistent on this. Visible blood in the urine, even one single time, is treated as a reason to investigate. And that guidance exists precisely because the people who do best are the ones who came in early. So here is exactly what to do, and I want you to hear the numbers clearly. If you see blood in your urine even one time, call your doctor within 24 to 48 hours. Do not wait for it to happen again. Do not wait for it to hurt. When you call, use one plain sentence. Say, "I have painless, visible blood in my urine, and I would like it evaluated." That sentence moves you up the list. Before the visit, if you can, note 3 things: the date, the color, and whether you saw any clots. If you take a blood thinner, mention it, but do not stop it on your own. The test itself is usually simple: a urine sample and a conversation, sometimes a scan. The whole point is that a 5-minute call today can replace a far harder road later. Now, please do not panic because panic makes people hide from the answer. Most cases turn out to be treatable, and many are minor. So while you make that call, stay calm, keep drinking your normal amount of water, and rest. But here's the clear emergency line. If you cannot pass urine at all, or you are passing large clots and feel faint, weak, or your heart is racing, do not wait for the appointment. Go to emergency care because that is a today problem, not a next week one. Pair this one habit with a simple rule for the whole family. Teach everyone at home that painless does not mean harmless, and post it on the fridge if you must. Because the person who reports blood on day 1 instead of month 3 gives themselves the best possible odds, and that is a gift you can give yourself right now. Make it a rule the whole house knows by heart. This is why I told you at the start to stay until the end. Every other change on this list is important, but this is the one that people talk themselves out of again and again simply because it is quiet. Report this one signal early, and you may protect not just your health, but your independence for the next 10 years. That single phone call is the whole reason this video exists. Let me show you how this plays out, with a typical case documented in the clinical literature. Consider a 71-year-old man, active, still gardening, still driving. One morning, he noticed his urine looked faintly pink. It did not hurt, and by the next day, it was clear again, so he told himself it was nothing, and he waited. Over the next few months, it happened twice more, always painless, always clearing. Then his daughter, who had watched a video much like this one, asked him one direct question. Had he ever seen blood in his urine? He admitted that he had. She helped him make the call that same afternoon, and he used the plain sentence, "Painless, visible blood, please evaluate." He was seen quickly, gave a sample, and had a simple scan. Because he came in when he did, what was found was small and caught early, at a stage where the options were far gentler and the outlook far brighter. The doctors were clear about one thing. The months he waited were the risk, and the call he finally made was the turning point. That is the entire lesson of this list in one man's story. So let us turn all of this into something you can actually start tonight. Here is your checklist, and every step has a number, so nothing stays vague. 1. Tonight, put a small notebook and pen in your bathroom. Start a 7-day log of anything that changes: the stream, the frequency, the color. Numbers on paper are what a busy doctor can truly act on. 2. This week, if you have seen blood in your urine or your stool even one single time, call your doctor within 48 hours. Use the plain sentence we practiced and do not wait for it to happen twice. 3. For the next 3 nights, count how many times you wake to urinate. Write the number down each night so you do not rely on memory. If it is 2 or more and it is new, that number is going on your list. 4. Before your next appointment, write one single list of every change with a date beside each one. Hand it to your doctor at the start of the visit, not the end. 5. At that same visit, ask about the one screening test you may be due for. Whether it is for your bladder, your bowel, or your prostate, let your own doctor decide what fits your history. Screening is how these problems get caught before you ever feel them. Before you go, think of one person in your life who needs to hear this. Maybe a husband who shrugs things off, or a mother who never wants to be a bother. Send this to them today, because the sentence that saves the most time is the one that finally gets said out loud. And tell me in the comments which of these 5 changes you are going to report or start tracking tonight. Your answers genuinely decide what I cover next. If this gave you the science your last appointment did not have time for, subscribe to this channel, because that is the whole reason it exists, to give you the 20 minutes a 12-minute visit never can. That is the promise, and I intend to keep it. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Judy Vance. Don't forget to subscribe and live longer.